I certainly say, Madam Speaker, and I think Oregonians will agree with me.
Political bodies exist to secure responsible government and to execute the will of the...
All right, everyone, welcome to another podcast of Oregon D.O.G.E. D.O.G.E. is a discussion on government efficiency, and that's what we're doing here today. And today we're going to be looking at the Oregon Health Authority, which is, of course, an agency that takes a lot of money. But today we have as our guests Representative Ed Diehl and Senator Suzanne Weber. Thanks for being on the Oregon D.O.G.E.
Well, thank you for the invitation to be here.
Well,
absolutely.
Now, healthcare has been, of course, a service that all of our constituents use.
Yes.
And and Ed, you're on the health care committee, right, Rep. Diehl?
That's right. I serve on behavioral health and healthcare, and then Joint Ways and Means Human Services. And I don't know why I was punished with that. I'm an engineer. But, no, I serve on the board of a hospital, and I think the caucus, when I came in, said, "Hey, he knows something about healthcare." So
good.
And while I was in the House, I was on healthcare also. And then in the last session, I was in human services.
All right, so you guys both have extension. Now, I'm Senator Mike McLane. I represent District 30. And but why don't Rep. Diehl, what district? And let folks know where it's from.
Yeah, I have District 17. So that covers East Salem through the majestic Santiam Canyon. So that Highway 22 corridor.
I drive through your district all the time.
Yeah.
On my way home.
Yeah.
And I'm in District 16, and I'm the North Coast, Northwest Rural Oregon. I am Tillamook, Clatsop, Columbia, Rural Washington, and Rural Multnomah counties, and I also have part of Yamhill County.
Wow, that's actually a lot of counties for a fairly compact area.
Yes, you should just try driving it.
Well, we also have on this episode our resident researcher, Ben Schmoller. And Ben, thanks for joining us.
Thanks for having me.
Thanks for doing all the work on behalf. So, Ben, you are, of course, a Central Oregonian. Why don't you share with the viewers a little bit about yourself?
Yeah, I am currently living in Redmond. I love it, and I've got the opportunity to work in politics a little bit. I used to work for State Senator Knope, and then I got to run the Central Oregon District Office for then Congresswoman Chavez Dreamer, and now our awesome Secretary of Labor. And now I'm back in the building working in policy for Representative Anna Scharf. So glad to be here, glad to be a part of the team, and ready to see how we can make our government a little better.
And I understand you've got some really fascinating research that you're going to be sharing with us also.
Yes, that's right. And I'm hoping it'll lead for good conversation prompts for the three members here to share even more detail about all the work that you've done for your constituents and to help try and make Oregon a little better. So there'll be, I hope, good conversation kindlers.
All right, so we're going to go over the Oregon Health Authority. We've gone over, what our budget in the state looks like and why we have a need to have Oregon get its house in order and to prepare for what has certainly set up escalating debt. I mean, it's set up in essence, there's going to be a reduction in federal funds. We know that. We know that because the budget deficit is atrocious at the federal level. And there's lots of controversy about what the Trump administration's doing now, but I keep holding to the point that it's going to happen sooner or later.
It has to happen, and we can't fund social services by putting my grandchildren in debt. It's unsustainable. And that's what we're doing.
It is, and so we're looking at. We've talked about all sorts of things. We've covered ODOT and BOLI. We've covered, we even looked at some bills that have didn't work out. We're going to be doing that more later. But today is the Oregon Health Authority. So, Ben, why don't you, did you start us with a little game here?
I didn't. I put the game at the end to try and wrap it up. But we can switch to that.
No, that's
now.
fine. You know,
Okay.
we have this little thing about where does Oregon rank, and then it's a little game between us. But hey, Ben, at the end, that's fine. Alex Lopez, which of course the viewers love. He always does.
Hard not to love Alex.
Hard not to love. All right, so what do you got today?
All right, perfect. So I thought I'd start us off with a brief overview of the agency by the numbers. And so, as you can all see here, there's about almost 5,000 rules and over 5,000 pages of regulation.
And these are the rules promulgated by the Oregon Health Authority.
Correct.
And the Oregon Health Authority hasn't been around forever.
No.
It was created, in 2007, and it was pulled out of the Department of Human Services, made its own agency. So OHA, wow, you've promulgated a lot of rules in a short amount of time.
Yes, that's right. And we see right here, there's last biennium had a pretty significant budget, $35.8 billion.
With a B.
With the B, yep. And we see the governor's requested budget for this upcoming biennium's got $39.6 billion. And there's
Now let's do the math here. So that's roughly about a 15% increase.
Yeah, well, it looks like about
Maybe 11,
roughly
12%.
Yeah.
So if you factor that out per citizen in the state of Oregon, what do you come up with?
So that's a great question. I'm not great at math on the fly, but I could pull out a calculator.
Well, that's interesting because there's
A lot.
It's quite a significant chunk, and
Yeah.
We're about 1 in 3 Oregonians is on some type of public assistance, not counting Medicaid or
Yeah.
Medicare, not counting Medicaid.
Medicaid. Yeah. So it's a big chunk of change, but
yeah, it's about 6.2 billion of that was going to be from the state general funds in that 39.6 billion governor requested budget, and that would be roughly a 6.7 increase from the last biennium in the governor's requested budget for the Oregon Health Authority.
all right. So a lot of money is being spent in the state of Oregon by the Oregon Health Authority.
Yep.
And so this is their mission. What's interesting, it was created in 2009. There you go. And the mission, so we're not talking a long time. We're 16 years this agency's been around. But it's to consolidate most health-related programs into a single agency. The budget consists of 7 program areas: the Health Division, Health and Policy Analytics Division, Public Employees Benefit Board, Oregon Educators Benefit Board, Public Health Division, Oregon State Hospital, and Central Services, Shared Services, State Assessments, and enterprise-wide costs. And of course, we have our legendary Cover Oregon. You remember the website? You remember the fiasco called Cover
Yes.
Oregon?
Yes,
I've
I
got
do.
a little fun about that too later. So
All right.
definitely that'll be in our chat.
So any comments, I mean, from those, I've never been on the health committee. So how's OHA doing?
Well,
Go for it.
I'm really unhappy with them at the present time. You know, we lost our provider for dialysis in Tillamook a year ago, February. In the middle of the winter, we have people who are seriously ill that are having to find alternate health care that is necessary for their survival. And so our Adventist Health worked really hard to get another provider. And so they were they probably, I don't know how many they went through to be able to get someone to come in. The last provider felt that they needed at least another $300,000 in reimbursement to be able to sustain the Tillamook situation. Well, we did find one. Okay, so now, even though that facility had been there for almost 20 years, servicing, seriously ill people, OHA now has to come in and vet the whole property and oh my goodness sakes, you got to have new permits, you got to have this, you got to have that. And we've known this company was coming in to be able to provide this, but it's not in operation yet because of all of the red tape that has to be gone through by OHA.
But we just passed a bill to fix that
Did we?
out of behavioral health and healthcare.
In the House?
Yes, to streamline this regulatory mess that she's talking about.
Oh.
Yeah, it's crazy because the rules, the place has been closed for a few months,
Yes.
but the rules read like they have to open it up like as if it's a brand new facility.
Yes.
They got to do a bunch of remodeling.
Right.
And
What is it? The
Representative,
placement of a sink.
yeah, it's ridiculous. But Representative Javity
Yes.
worked with the OHA and brought a bill last minute, and we just passed it out of committee. So it'll be headed your way.
Good.
Yeah.
Because, there's a lot of other things that are influenced by the fact that these people need this constant health care. And one of them is our transit system. So this is, in helping these people get to Seaside or Lincoln City or Hillsborough, the Portland area, they need that transit. And so this is putting a strain on our transit system. The ability for them to pick up people in town and take them to their medical appointments has been stretched to the limit because, it's 2 hours to where you take the person, and then they have to be there for 3 or 4 hours, and then it's 2 hours back. So the cost for being able to transport people to get this service is really putting a strain on our transit system.
So interesting. So when OHA delays, and that's one example of just not getting or perhaps over-regulating to just get something done, there's consequential or unintended consequences, or attended, as the case may be. But, it's really interesting because when you look at the sheer volume of regulations, I wonder how many people have read those. When you stack up, that's like 10 reams or 11 or 12 reams of paper. That's just the regulations.
And it is so, this came up in the hearing over this particular issue that the senator's talking about. Is like we regulated common sense to death. You cannot, what would common sense say? Hey, we just closed this facility down. It was operating. It was fully functional. We have a new owner. Let's get it going again. We have people that are needed. We know the facility's set. The regulations do not allow it.
Yeah,
and it's just...
The thing is, when we asked for a special meeting with them, they were so cavalier about the fact that, oh, well, it'll take time, but we'll get there.
I can't believe. I suppose there's real time and bureaucrat time.
Yeah.
But nevertheless, all right, next slide.
Yeah. So next here is a good shot of the budget growth over time from the last few biennium. And you can see a steady bar rising now. The last one for 25-27 is actually the agency requested budget.
The governor's asking more than the agency.
Yes.
And I thought that was going to be
ironic.
interesting to highlight.
She has a lot of pops.
Well, the interesting thing too is we looked at their mission, but we're going to dive in to see what they're doing, and they're spending money where you just go, "Where's this in your mission?"
Yeah. And this is a good spot to just look at the bigger picture between OHA and ODHS. I think it's about 45% of the state budget. And we have, when it comes to Medicaid, our state has taken advantage of every Medicaid dollar that we can get. And we've got waivers all over the place.
From the federal government.
From the federal government.
Right, the feds, most of the
We have leveraged that to the fullest extent. So when we're talking about cuts,
Yes.
when we're talking about cuts from the feds, we are the most exposed, I think, of any state, meaning that we're going to get hit the hardest. So we're going to have some hard decisions.
So in the feds, can I follow that? Because the House, Congress just passed, the funding or continuing resolution or, so, and then I heard from Legacy Media and several of my colleagues in, passionate remonstrance on the Senate floor denouncing that and saying they had cut Medicaid. So I just went, well, is that true? And I looked it up. And what they did is they reduced the growth of the Medicaid budget, but there were no actual cuts.
No.
So what happened? Do you know what happened on that?
Well, I'm still looking for details on that. I'm just hearing that they're going to make adjustments. And maybe cut's not the right word, but it would be things like there's matching requirements. There's an FMAP, And so every state, based on the wealth, basically the wealth of the state, determines the contribution that the state has to give to bring the funds down.
That's
so
interesting.
that percentage, I think, is going to go up. So we're going to have to, the state's going to have to come up with more money to pull the same federal money down. There's other things like the provider tax. Do you know what that is?
Oh, sure. Yeah.
We passed it, right?
Right.
This year.
Yes,
House
we
Bill
did.
2101 this year.
It's a shell
Yes.
game.
Right.
When I got in the legislature in 23, I'm up at OHSU and they're talking about this. Like, is this legal? Can you do this?
Rep, could you maybe break it down a little more just in case our listeners aren't familiar?
So the way the provider tax works is, so the state has to come up with some state funds in order to pull, you need matching funds in order to pull the Medicaid dollars down. So what we do, and what a lot of other states do, is they tax the providers. And so the providers are taxed. That money goes to the state. The state then shows the federal government, here, federal government, see, I collected this money. We get Medicaid dollars, and then they redistribute that tax, the tax they collected, right back to the providers. It gets distributed slightly differently than the way it came in. But it is a shell game. And my understanding is that some adjustments are going to be made on that. I don't know what.
At the federal level.
At the federal level. And I think there's some programs that were put in place with the Affordable Care Act that Oregon has taken advantage of, this bridge plan, which provides almost 100% funding, Medicaid funding for people from 138% of the poverty level to 200%. We're like one of 3 states that takes advantage of this plan. And so I think that's going to change. Yeah, we're talking about significant impacts.
So do you have any, Senator Weber, any intel on what do you think's happening with the feds when it comes to the Medicaid budget?
Well, I think they've taken it's a creative opportunity to interpret something that isn't the truth.
Well, that's put very nicely. Care to elaborate, or?
No, I think we're going to see, and it's going to prove out that it is not what it is interpreted to be.
So and one of the things that I know we're doing on this podcast is trying to let people know what's coming, but specifically in the OHA budget, there will be adjustments at the federal level, in part because of the demand on the federal budget. And even if they slow the growth, it's going to have consequences here. So what I'm hearing you two say is we've grown our Medicaid budget by every almost nickel we could pull from the feds.
Yes.
And now we have significant system. So if there's reduction,
well, the state's going to have to make up that difference if they're going to continue at the level that people are used to.
And that money comes from the general fund.
It's going to come from the general fund. But, we're hearing in each of our budget committees that we're going to have to really tighten our belt because that money is not going to be there. So all of these agencies are tightening their belt because they know there are other opportunities for the state and the general fund to have to reimburse what's coming.
And, the interesting thing is, and not being on the healthcare committee, but on the budget committee and judiciary and revenue. But one of the things that I've seen is so many bills get sent down to Ways and Means, $6 million here, $2 million here, this program. One of them was for legal aid services to non-citizens. And, and part of the argument is, hey, there's been this system set up. And one of the questions I asked was, okay, who's all doing this? And if you want $6 million, I'm not denying that people have a need for legal services, and in that the documentation process with the feds is not easy. So getting someone the assistance of an attorney, I get it. Great thing to do, and there are a lot of nonprofits providing it. But the question is, how much money are they spending? How much money is coming from churches and synagogues and private donors? But when they asked us for $6 million, my first thought was, what am I saying no to? Because if I say yes to this, I'm going to have to say no to something else.
Right.
Right. We have to make tough decisions.
Right. And we have to continue to ask those questions. Okay, you want $6 million. What exactly do you how are you going to use this? What is going to be what you're going to use to administer the program? How many people are you going to have to hire to do this? We have to continue to ask those questions because, we're just thrown these money amounts at us, and we're expected to say yes. Let's go to Ways and Means. Let's make this happen.
And I think the Ways and Means, what I'm hearing you're saying is that this absolutely, we have to prepare. It's absolutely coming, and the only way to sustain these programs, which have been created in Oregon, other states, OHA certainly has undergone some mission creep. But if we've created, gamed the system, which was lawful, but now we have a lot of Oregonians. Is it 1.3, 1.4 million?
Yeah,
Oregonians?
1 in 3 are on some type of public assistance.
Medicaid system. And so the question is, do you reduce the population? Do you reduce the number of services? Or do you go to the general fund and say, we're going to say no to these other programs so that we can backfill?
Well, we have our approach, I think, with Medicaid is to spread those dollars across a very large population. That's been the approach, and we do all these demonstration projects really to leverage every dollar. We're using Medicaid to buy air conditioners, provide housing subsidies.
Yes.
Housing
provide
subsidies.
Food. Yes.
Right.
Yeah.
I thought
in ways,
healthcare.
and it's a several year demonstration project. It's almost all federally funded. So and that's just one example of a program, the bridge plan I talked about earlier. But those programs are going to be scrutinized, I think. For example, and the other thing I've learned in the legislature, there's no such thing as a temporary program.
Right.
Well,
I've seen the governor complaining about, hey, the Trump cut the funding to our food banks. Well, that was a COVID relief program. Yeah, it ended. We should have expected it to end. Well, he's done something similar with some of the one-time Medicaid funding. And so she's complaining about that as well. Well, it was a one-time thing. Why are we building an institution around one-time funding?
but we see that in the legislature all the time.
All the time.
We have to renew this because this has to continue. We have to renew this because this has to continue. We need that. Why don't we make things so that they are permanent in the beginning? So we're continuing these programs.
Well, and even though you have, and I know I was talking with some folks in my office the other day, even though you have a program that was just started and it is not funded for the next cycle, what you do is you gear up these folks. Could be a great program. And this particular one is really good. It's a family network, and they help families and who are accessing hospitals and other services, and it helps them. So no issue with the program, except that they got money, they got the program set up, and now they're back asking for whatever it was, 2.5, 4 million, I can't remember. But it's, again, that's another ongoing program. Are these programs necessary, or are these programs certainly a wanted and attraction, a want versus a need? We're going to have that discussion. But as you can see, the budget growth, we had significant growth in 2021 from the previous, and then a significant growth here. Now, I don't know, but based on what you were saying, Ed, that looks like a lot of COVID money in there. I don't know how much of it is the one-time money, but quite a bit of growth in that short period of time.
Well, I think what happened is coming out of COVID, our tax revenue, state revenue increased. So we ended up taking one-time COVID relief money and replacing it with state tax dollars.
Oh, because
So those
money. All
those
right,
programs,
9.9%.
some of them have kind of stayed. I believe that's what we're seeing.
All right, Ben, what's next?
Yeah, here's some more interesting growth, position growth
Yeah.
in the agencies. There's been substantial growth since the 2017 biennium till the last biennium budget of there was almost 1,000 positions added from 21 to 23, and about 900 positions.
That's one of the reasons why the largest growth in employment is the state government.
Isn't that
Yes.
interesting?
And
in Oregon?
manufacturing went
Yes.
down. The Federal Center for Medicaid and Medicare has 6,000 employees, and we have 5,600 for our state anyway.
Yeah, so pretty substantial growth.
Yeah.
And those are living wages, or what are considered living wages.
Yeah, I imagine those positions are not on the lower end of the scale, but certainly that includes the director of OHA,
Yep.
Dr. What's her name? I can't.
Hati.
Hunty. And who certainly paid a lot. I mean, obviously she's a very qualified person and could make a lot as being a doctor, but Jen, I think you're right. I think those are pretty good paying jobs. But what's next, Ben?
Yeah, absolutely. So we've kind of already gone into this a lot, but this was just an article talking about the cost creep of medical costs, and as well as a reflection of the budget. And I was curious to hear from each of you if this is kind of a tail wagging the dog situation, or if this is just the inevitable growth of government to combat and help lower the alleged rise of medical costs.
I might also add that we've got 33% of adults have skipped or delayed a medical appointment because of the price. It's the price and the accessibility of having a primary care physician or being able to get into a medical facility for an appointment.
I would imagine we're no different than any other state in the cost, the escalation. But as you said, it's not just isolated to cost. There's access issues.
There's access issues, and we have a lot of access to the cost, to the money. You've said that.
Yeah.
So people have to have insurance now. They're paying a lot of money for it, especially retired people. And so they're taking advantage of these appointments, but those doctors and care people have disappeared, especially in rural Oregon.
Yeah, we're seeing it in certainly my district, in north part of Central Oregon and everything east and south, and it's, it's tough to get providers, and the cost continues to escalate. The cost creep not only, and I would imagine that spending of about $8,000 per resident in 2021. It's even higher now. I don't think that's the Medicaid budget. That's probably all folks, because
Yes.
the Medicaid budget
Yeah,
is that just the Medicaid
I think that's
budget?
health insurance. Is that private health insurance? I wasn't sure about that.
So I
number.
think that is a significant piece of that as well. There's one, I think this goes to what you were talking about earlier from the revenue forecast. There was kind of when we saw that come out, the areas of growth were government and government adjacent areas like healthcare and higher education. And
Yes, and you look at the medication or failed to refill a prescription. Look at how our pharmacies have disappeared. The cat tax has taken many of them away, especially from rural Oregon.
yep, absolutely, for sure.
And then, there are other issues. So my daughter fell down, broke her arm mowing the lawn. She went to the hospital. They set her arm wrong. So they said, you're going to have some problems with this. You're going to need surgery to have it rebroken and reset. 3 days before her surgery, she got a call from the hospital telling her that she needed to bring a check for $4,000 in order to have this. She said, I'm fully insured. Why do I need to do that? Well, I said, well, that's in lieu of any costs that may also be incurred. And she said, I'm not going to do it. Does that mean I'm not going to get the surgery? And they said, oh, no, but we just, basically hedging
Sure be
their
great
bets.
if you'd come in with $4,000.
Yes.
Preferably in 20s
So
on marked bills.
my friend in another community needed a hernia surgery, fully insured. He gets a call from the hospital telling him to bring a check for $15,000 to hedge his bets on the costs, and he's fully insured. Fully insured. He didn't do it. He said, no. Does that mean I don't get the surgery? No, but, there will be other unintended costs that we need to have, covered. So there's other things that are happening in the...
Yeah. Well, part of the issue with healthcare is it's so regulated, and it's almost impossible now for a private family practice doc to set up shop and do business. The reports, the audits, all that stuff, the electronic record keeping that's required now, it makes it impossible. And so we've seen a lot of consolidation in this industry because of that. But also, so you're reminding me, and I brought a bill. It's headed your way.
Oh, you passed it.
Yes, I actually got a few bills passed.
Wow.
Yeah, but this bill would allow an Oregonian to pay cash for a procedure. Go because there are doctors that are outside the insurance system, and that cash can be used against your deductible for your health insurance, which is something you can't do now, if it's something that would normally be covered by your health insurance. And why is this important? Well, it turns out that there's certain procedures that are way cheaper if you just do them cash versus going through your insurance. So an example came up. I think it was an MRI. Might cost $1,600 through your health insurance, which would eat up your entire deductible.
Right.
Or you go to a cash-based doctor, get it done for $400.
That's interesting.
Yeah.
I didn't know that.
And so we presented that in committee, and everybody, hey, that sounds like a good idea. And the health insurance companies were neutral on it, and we got it. I think it passed the floor of the House unanimously. So.
Well, let's hope the Senate doesn't screw it up.
Yeah.
Sounds like a good bill. But all right, Ben.
So touched on this a little earlier, but this is some of the impacts on costs. So this is looking at illegal immigrants benefit from certain types of Medicaid here in Oregon, and primarily through the Oregon Health Plan. It used to be known as Cover All People, and now it's known as Healthier Oregon. And the cost of the program in Oregon, the whole cost of the entire program is roughly $250 million to $350 million in certain windows. But these are some of the windows of care that are covered to illegal immigrants through this. Is emergency care, family planning, vaccines, mental health services, including counseling, case management, advocacy, and referrals to other programs, treatment for pregnant women, children under 19, and some other types of care may be available as well. And this is all from their website.
So if someone's undocumented in Oregon, you can't get Medicaid reimbursement from the feds. Is that correct?
So there are, for some non-U.S. citizens, there's Medicaid available. And I think what you're hitting on there is that program. This isn't the Healthier Oregon program.
Okay, well, this was what I saw on the website.
Okay, so today the Healthier Oregon program is like Medicaid. It's Medicaid style coverage for people that don't qualify for Medicaid, and it's entirely funded by the state. No Medicaid dollars to it.
Is it they don't qualify because they're not documented,
because
or they're over the
undocumented, or for whatever reason they don't qualify.
Okay.
So some non-U.S. citizens qualify for Medicaid services, and there's some restrictions. But
so these are folks in the CCO system?
Yes, they would be in the CCOs. To the
yes.
system, they look just like any other.
So at coordinated
person,
care
but it's
organizations,
entirely-
it's a capitated rate. The state pays X amount per month. Is it $500-600?
Something, and it's in the 600s, I think.
And the CCOs then facilitate the care between the primary physicians, hospital, dental, et cetera. And that's our CCO system or coordinated care
It's a
organizations.
little bit different in that the CCOs for regular Medicaid, they're taking the risk. In the case of the Healthy Oregon program, the state is taking the risk.
Oh, okay.
So if there's like savings, that goes back to the state. But it's entirely funded by state tax dollars. And
General
it's
fund.
$1 billion.
$1 billion. That's
every
what I heard.
budget cycle.
$1
$1
billion
billion
every budget
for
cycle.
non-U.S. citizens.
And it used to, and it started out when I was in the House last decade. It started out with we're going to just cover children of people who are not documented, projected to be.
That's right.
And they said, "Hey, we can't get a reimbursement from the feds, so we're going to do this." Projected costs at first was, I think, about $85 million. Then eventually it kind of got up, and they said, "Well, it could cost us about $180 million."
Then they just expanded.
And
to
then
everybody.
then there was
recently.
they said now it's not fair. We got to cover the parents. We got to cover the sister, the cousin, whoever it is. But it expanded, and now we're talking $1 billion of general fund money for a program that wasn't around. Not that long ago.
Yeah.
And again, the point of this podcast is, we'll dive down later on in a podcast on some of the OHA, bills and things like this from the purpose of just from the standpoint of saying, is Oregon ready? It's because, look, you could say this is a great program, and who doesn't want children covered, or who doesn't want people getting access to good medical care? Because we have a charity care law, right? If someone stumbles into emergency room, the hospitals have to treat them.
They have to treat
whether
them.
they financially can or not. I mean, pay. But when you think about just the fact that $1 billion of general fund money, and that's real money. And so is it okay? Is it okay to ask the question, do we have the financial resources to continue to do that when we're saying no to a lot of other programs?
Well, this is the part that I really struggle with, because we have taken all these dollars and we spread them across a large population of people.
Mm-hmm.
I don't believe everybody that's getting these services really needs these services, just to be frank.
Mm-hmm.
There's another group that desperately needs these services, and I'm thinking of people with intellectual and development disabilities, and we're underfunding those. I mean, we have some places that provide these residential services for people who desperately need our care. They're the most vulnerable folks in the state, and they're operating in the red because their reimbursement rates are below their costs. They've had inflation, wage inflation, everything else. So we're kind of shortchanging them in an effort to spread these services across, 1 in 3 Oregonians. And so I think we really need to rethink how we're delivering this care and how we qualify people for these dollars.
Well, the governor's whole focus in this session is accountability. Where is that accountability for OHA? Why isn't that getting the same attention as education and some of the other things that she is demanding accountability for?
And I noticed that the governor says, Tina Kotek, Oregon's governor, says, we're going to hold, like in education, she said, it's not a blank check. You got to be held accountable. And we're like, when was the last time you held the teachers union accountable? Come on, but I digress. All right. So we got some options. You could reduce health plan inflation from 3.4% to 3% per year. That would save $145 million. So these are just some of the things you saw. Where'd you get this?
These are from the governor's recommended budget.
Oh.
So these are some of her recommendations, and It's roughly a 10% reduction options picture wide that are in the governor's requested budget.
So
for
one
each
option.
agency.
Her focus is reducing everything by 10%.
Not necessarily everything, but the budget.
Just about that budget.
Yes.
Yes.
So reduction to OHSU reimbursement from 87% to 84%. But here's what you were saying, Ed. I mean, you're picking and choosing at that point, right? You're shortchanging some and you're to fund others. Reduction in funding for the healthcare incentive fund by, 35%, yada, yada. OPEB plan reduction, that saves a lot. OEB and PEB, fully insured and self-insured plan reductions, $411 million savings on public employees. Well, Governor Kotek, I remember the last governor who tried to mess with PEB, Governor Kitzhopper. I don't think the public employee unions appreciated his discussion.
Well, this will be interesting with PEB and OEB because my understanding is their insurance plans are going up 20-some%. Something like that.
Holy moly.
Wow.
So they're, they go with, I don't know who provides it, MODA and some others.
Yeah, they're ODS, I
but
think
it's
is
all
the-
publicly funded, right? And so they're looking for some relief on that front. But when I quizzed them, I said, well, what's the deductible? And they don't have a deductible.
Yeah, I must admit, it's
And
gold-plated health
It is
plans.
gold-plated.
It is.
Well, regular Oregonians. So I was in the private sector, right?
Yeah.
I was employee and an employer. I always had a deductible. And
Always.
my rates would go up. Sometimes we had hits of 20%. And we would have to adjust the deductible and all that stuff.
You
and
do
co-pays.
with your
To try and
insurance, then
mitigate
figure out
that
how to-
risk. So I'm having a hard time accepting PEB and OEB wanting the taxpayer to eat all that cost. Hey, maybe you guys should look at taking. Maybe you should go with the silver plan instead of a
Well,
gold plan.
one idea for our viewers and to make Oregon more efficient, Oregon's government, is what we could say is, look, why don't all the public employees who have a tremendous healthcare plan, that's a tremendous benefit, if they were all rolled into the CCO system at the capitated rates.
That was the idea originally. That's
Well,
what
I'm
I
saying-
heard. I
yeah.
wasn't around then, but I heard that was the
saves
plan.
billions and billions. To quote
Yeah.
Dennis Richardson, our late Secretary of State, billions and billions of dollars. But politically, good luck with that.
Yeah.
All right, move on, Ben.
Well, here's an area that is untouched, and I actually got some of this data from you, Rep. Diehl. And so
All
this
right.
is the OHA's Equity and Inclusion Office, which has 256 positions, and the total costs of their budget are nearly $56 million.
$55.8 million for equity and inclusion
Position.
office.
Yep.
The
And
state spends
OHA.
close to $100 million just on DEI salaries.
What was that?
$100 million.
For who? For OHA?
State agencies,
Oh,
all
state
told.
agencies,
Yes.
all
So-
of them.
and
Half of it going to OHA
Yeah.
at least. Holy cow. And the administrator is making $431,000. The administrator of the OHA
This
Equity
is
and
a
Inclusion
biennium
Office.
number.
A
but
biennium. All right. So their salary per year would be $215.
215.
Okay. All right. Well, that's not nearly.
No.
Ah,
Yeah.
That's nothing.
whatever.
But I mean, I think it's just interesting when you look at where these costs. And again, I mean, this is a lot of people working on this issue. Where this is, in my opinion, not a lot of money actually going towards addressing these issues that claim to be a major priority for them. Just going to the salary of 256 individuals in this agency.
And $55.8 million per biennium, so roughly $28 million per year.
Mm-hmm.
And of course, if you ask people and you drill down into some of it, they'll say, "Hey, this." And in isolation, everyone can always justify, and in fact, be quite indignant that your inquiry would question the legitimacy of their efforts. But sooner or later, we have to ask the question because general fund money is going to have to go to backfill in the years we start coming up on in this issue of our budget. we have to start asking the question, how much equity and inclusion positions do we really need versus want?
0.
Well, there's that alternative, and there could be some legit. I don't know.
Okay, so what are they doing?
What are they doing is a great question, and I think that's on a later podcast. But that we should, in fact, Ben, would you put that on the list?
We'll put it on the list.
Let's find out what are they doing. I'd love to interview an OHA equity in person to say, what's your day like? Tell us what you do.
Well, what's your job description? What job description were you hired under?
Yeah, absolutely. And actually, the rep has a great spreadsheet with some of that data of their titles and their those positions.
For
and it's
every state agency.
Yeah, for every state agency.
Well,
So
because we have to ask.
right.
We got to ask. All right, let's
Go on. So this is some of the fun that we've had with hiccups with Medicaid dollars here in the state of Oregon. And so this is a story that came back. This is way back in 2017, but the state of Oregon may have dispensed millions of ineligible Medicaid recipients. And so this was working as many as 115,000 Medicaid recipients have qualified for extra benefits. And the average recipient for the state and federal governments were receiving roughly $430 a month. And so if this back then, and it could have outlaid to about $72 million a year if it wasn't caught.
Well, and the rolls do get would you say it was 1.3 million or 1 out of every 3?
1 out of 3
Oregonians on Medicaid. And all right, move on.
Yeah. And so this is,
I think. Oh, sorry. On those, some of those are because they're getting duplicate benefits. They're either privately insured or they're receiving benefits in another state. I think.
Wow.
And we're out of compliance. We still are out of compliance with the federal requirements on that front.
wow, that's serious. When this one is from 2023, and this was an audit that the Oregon Health Authority mishandled hundreds of thousands of dollars in federal mental health money, and they ended up spending almost $600,000 of federal grant money illegally used on the expansion and remodel of OHA facilities that was meant to go towards behavioral health and addiction services.
I had not heard about that until.
Yeah, that's and I think that's got obviously a lot of things you can say, but I would say that's a really good way to not win a grant again.
I would think that hundreds of thousands is probably a soft way of putting what has actually been mishandled.
Right.
I think it's considerably more than that.
Yeah.
But I think this is a nice, soft way of saying they screwed up.
Definitely.
So, and we're talking not that long ago. So this article was up in June 15, 2023. So, and people say, well, gosh, the budget's so big. What about this? What about that? But again, if we're talking about waste and, waste, fraud, and abuse is the coin words, but we're talking about waste and we're asking the question, how does Oregon allocate its tax revenues in a way that delivers a government that people want, people deserve? And to find out the federal government's own audit, and this was during the Biden administration, that they said, oh, by the way, $575,000 was supposed to go to people with behavioral health and addiction needs. Instead, you spend it on a facility, which I step back and, if that had happened in the private sector,
Somebody'd be fired.
someone would be fired or indicted.
Or going to jail.
Right.
Yeah.
And, but I guess Oregon is, oops.
No, you get promoted.
Let's see. So this is another more fight. So we have Washington, Clackamas County in 2004 story are suing the Oregon Health Authority when they did a remodel adjustment for their plans of addressing addiction. So nearly 430 million flow in the coming years to address addiction. And when these were reassessed, the lawsuit basically accused OHA of not using proper standards. And, whether or not this is true, I think it's just more of also a frustration of now these are taxpayer dollar costs of twice, right? You have government suing government, And so they're going to spend
Yeah.
those dollars to fight this out, to make sure that they're using our tax dollars correctly.
And you look at the fact that we have so many people on our streets that are homeless and have mental issues. Is it because in the past we misappropriated the money that could have helped these people and kept them off the streets? Just something to think about.
Absolutely. Absolutely.
I had to do a public records request to get their calculation,
Wow.
and because they were suspect that they're not distributing this, they're not allocating it properly, and
Well-
it showed that they weren't.
Well, that's interesting that a member of the House of Representatives has to do a public records request on a state agency to get them to produce
Yeah,
documents.
they wouldn't give it to the counties.
Well,
Have you ever had this happen? The Oregon Health Authority, we have this thing called the prioritized list. Instead, we don't follow normal Medicaid, what's covered and what's not covered under Medicaid. We have our own unique way of doing it called the prioritized list. And OHA did a study to compare how we do it with other states. And we have a report. So I asked for a copy of that report. They said it's client attorney privilege. I cannot get a copy of that report. Have you ever
you're
heard of that?
kidding? No, I've never heard of it.
I'll share this with you. You're a lawyer, right?
I
I'm
am.
going to let you look at it. I elevated
Yeah.
it, and then I talked to the top of the OHA. Oh, I'm sorry, we can't.
How can that be?
How can you not? How
And-
can I not see that? And we're expected to legislate around the prioritized list.
And
I mean-
we're a separate branch of government, and
Yeah, I
they're
couldn't believe it.
stonewalling.
I could not believe it. I go,
Well, we're going to follow up with that.
yeah.
Definitely.
Please
Sorry,
do.
that was
Let us know.
Okay.
This was touched on a little bit earlier. but
Infamous Cover Oregon.
The infamous Cover Oregon website. So
Oh,
in April 2014, Oregon spent $240 million on a website that didn't work and was eventually shut down. And one of my favorite parts about this whole thing was it was even so embarrassing that famous, certainly leftist comedian John Oliver mocked us on his show last week tonight. There was a commercial made by the OHA about how
I
amazing
remember.
this website was going to be.
Yeah.
And he did a
I
parody
remember that.
commercial about it. And it was pretty brutal.
That's right. That was brutal.
It was National Laughingstock. So, yeah,
So, yeah,
ugly
that's-
episode in Oregon.
Yeah, we
history.
just linked to the Federal Exchange, and they clawed back a little bit of money in a settlement that took a couple of years later. They got about $100 million back, but that's still
Yeah,
less than half. And
Well,
nothing
and
to
I
show
think
for it.
that was, just the website, but they also had Oracle, who was the company
Right,
that
yep.
did it. They had a bunch of other contracts. So Oracle did, I think, okay. But, ultimately, the lawsuit against Oracle was it legit or a political maneuver to try to, save the political skin of some folks? I have a theory on that, but I digress.
Yes.
Keep going.
So this
Oh,
one
my word.
is particularly gnarly. I remember watching this live when it happened. So back during the Halloween season in 2020, the OHA would do presentations about COVID deaths and impacts. And for some reason, someone thought it would be a good idea to dress up as a clown and go on live TV and broadcast the number of deaths that had just occurred.
That is abhorrent.
So Halloween 2020, dress up like a clown and announce how many Oregonians died that day.
Yeah.
All right. So tone deaf, inappropriate.
To
Wow.
say the least.
All right.
It's hard to believe that
That
that's
was
real.
not OHA's finest hour.
No, and so the recent story broke earlier, actually during session, about the director of the OHA is got a new opportunity and working down and she's a former member of the Biden administration, worked at the White House as a senior healthcare advisor, and now she's allegedly taking an unpaid job at Stanford University, but she is working at Stanford University as a member of their staff there at the Stanford University Hospital. So
Yeah, I know that's embarrassing. I must admit, I'm like, I don't know if I care all that much whether, she wants to do there in volunteer time or at Stanford or whatever. But I guess the real question is, how's the agency running?
Right.
And who's paying for her airplane tickets to get there?
So that's all on her. I mean, she came and testified in our human services.
Okay.
And so she got quizzed on this. Senator Hayden quizzed her pretty good.
Good.
But that's all on her dime. It's on the weekend.
But her parents live close to
And her
the
parents
university.
live close. Yeah.
All right. So,
But what there is a difference, though. We never see her in committee. We saw the prior director quite often, the interim director.
Mm-hmm.
Baden, we saw him all the time. I think we've had testimony one day from the director. That's
Definitely.
all right. Next.
Well, so we like to have a segment on this show
Yeah.
called
Reality.
the Reality Check. And
Reality
we talk
check,
about
Bill.
some of the bills that are presently in the legislature. And so this one we've decided to highlight is House Bill 2994. And this directs the Oregon Health Authority to establish a medical science liaison position to develop recommendations for advancing health equity and justice. And it's declared an emergency, so it'll be effective immediately as session ends.
Do you know, did the bill move? Do we know?
So I know it has not moved. It did not move. It did.
Didn't even go to Ways and Means?
It
This
did
bill-
not Ways and
Yeah.
Means.
Yeah, we didn't even hear this bill.
No,
I was thinking, where did this bill go?
No.
This was one of many of Rep. Nelson's bills that didn't see
That
the light
didn't
of day.
move.
Yeah.
Well, I guess OHA will have to wait on the liaison to develop recommendations for advancing health equity and justice and stick to its mission a little bit. All right, next.
Absolutely. So we're gonna wrap up with some game time.
All
And
right. So this is the time where we're going to have a little competition.
Oh my goodness.
So before you give us the answer, we're gonna give our answer. So
yeah. So our first question: where does Oregon rank in the 50 states in payment for nurses?
all right, write your answer down.
Oh,
I'm
we
just
write
kidding.
them down?
No,
Okay.
I'm
Yeah,
just
right,
kidding.
right.
Right.
I think maybe we're probably toward the top, maybe 15th or something.
Yeah, I'd say 10 to 12.
I'm gonna say 20th.
20, so it's actually third.
Oh, wow.
Third. Oregon
Oh,
ranks
my
third in nurse
goodness
pay.
sakes.
And we're only behind Hawaii and California.
Really?
Wow. I must admit, they have some intense lobbying efforts all the time.
They do. I've tried to introduce nurse licensure compacts, so we would honor licenses from other states and increase the availability of nurses. And the nurses union continues to kill that bill. They're very powerful
Yeah.
to the detriment of patients.
Yeah. The interesting thing about their salaries, I didn't realize it was that high.
Yeah.
But, good. We want nurses to make a good living.
Yep.
All right. I'm not
absolutely.
complaining.
So our next one: where does Oregon rank in number of pharmacies per 10,000 residents?
You're the bottom.
25th.
I'm going to say 35th.
All right, we've got 40th.
40th.
Oh,
All right. So we're almost last
we've lost so many.
in pharmacies.
Yes.
Definitely. And our last one: where does Oregon rank in number of medical beds per
Last.
1,000 residents?
I'd
Last.
say last.
I'm not going to say last because I believe in Oregon. I'm going to say 42nd.
Tough break, Senator. It's dead last.
It's dead last.
And you know why? That's by design. When they set up the whole plan, they said we're going to have such a healthy population
We're not going to
that
need
we
them.
don't need all these beds.
Well,
I'm not kidding you. And then something happens, a crisis, and we're like, oh, crap.
well, you're going to have to come back, both of you, I hope, and we got to talk about certificate of need and the whole system about that.
You know, I was just talking about that with Rep. Helfrich.
In the
I-
Back to Basics Army
Yeah.
podcast.
But I have 3 bills with Representative Lucetta Elmer
Yeah.
on certificate of need. And it's unbelievable. We cannot get a hearing this year. We could not get a hearing. these are companies that want to invest their own money to build care facilities
And move us from last
and
to
move
almost
us-
last.
Yes,
in bed,
and we
bed space.
cannot get a hearing. It does not fit into the model. You know what I'd love to talk to you about?
What's that?
The power of the public sector unions. in the
Well,
state.
I got to
I
tell
swear
you,
to they run that building.
They do run that building.
it is. They are a dominant political force. So, but that wraps up for our big episode on the at least the big where the budget's at and OHA, and specifically down into some of how they spend it. We're going to have an episode later on about some of these programs. We'll even look at some of the equity and inclusion funding. And at the time of our general fund competition, which is only going to get worse or more intense, whether you as Oregonians want to be spending money on this. But look, everyone wants good health care. We want a good health care system. We need a good health care system. The question becomes, how does Oregon navigate the next decade and what is going to be perhaps a reduction in the federal government's willingness to kind of be gamed a bit in its reimbursements, and then, of course, the overall number. But Senator Weber, thank you for being on. Representative Diehl, thanks for being on. I look
bet.
forward to seeing to everyone else. We'll see you next time.
Bye-bye.